My words of wisdom for patients are don't be silent. If you feel a certain way, get on that call light, click it till somebody comes in. It's important of any color, and I think this was addressed as well, because even as Black nurses, we have our own biases against each other. And so once again, that's a systemic aspect of even healthcare in general and how we provide care to each other and to others. I think it's important to see people. It's important to be the voice for the voiceless.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome again to another episode of You Belong in Here podcast. I am Dr. Tiffany Brown, your host. I am very excited to introduce you to my guest for today's episode entitled Pregnancy and Prejudice, Unpacking Racial Disparities in Maternal Health. I am speaking today with Ms. Crystal Miles-Threatt. Crystal has been a registered nurse for over 15 years, specializing in emergency medicine, where she currently works as a nurse manager of education and practice for the emergency department. As a transformational leader, she has a passion for maternal health and currently is pursuing her doctorate of nursing practice, of which her doctoral project's focus is recognition and early treatment of postpartum preeclampsia. Lastly, she is a member of the National Black Nurses Association, which I'll call the NBNA, on the NBNA Black Maternal Health Task Force, and recently elected Vice President of Silicon Valley Black Nurses Association. So let's give it up for Miss Crystal, everyone. Hey, Crystal.
Hey, Dr. Brown. Thank you so much for having me here today.
Thank you so much for joining me today. How are you doing?
I'm doing well. I'm excited to be here. I'm excited about this topic and to hopefully shed some light or provide some insight into maternal health disparities within the United States, and specifically California is where we live.
Absolutely. So this is an important topic. So I would like to jump right in. So Crystal, tell us a little bit more about your nursing background and your development for passion with the Black maternal health. Did this passion develop from some of your experiences in the ER as a nurse?
Yeah, so you would think that that's where it all started, but I feel as though you get impacted by certain things. Sometimes it's at home or sometimes it's at work. Specifically for maternal health, it actually came from home. Okay. We don't see that many OB patients within the emergency department. This is our our catchphrase is that if they're greater than 21 weeks, then they're going to go up to L&D. So we try not to really mix with any pregnant patients in the emergency department because that's not truly our specialty. But my twin sister was pregnant and she delivered my niece 5 years ago. But that experience truly was impactful for me because I was so very traumatized. My twin sister is my heart and soul. We're womb mates. And so when she found out that she was pregnant, it just brought her so much joy. So she was so excited. Her first and only daughter. We had this birthing planned for her. I was going to be in the room with her and her husband. We were deciding on which date. She actually waited for me to come back from Kilimanjaro because I was hiking before she actually delivered. So she waited for me to actually have baby Ryan. And we were in the labor and delivery for 7 days, which is a fairly long time. And then on that 7th day, it was around 11:30 at night. They came in suddenly, the team came in and was saying that the baby wasn't doing well and that they were going to have to do an emergency cesarean on my sister. And it was truly traumatizing for me because whenever you see a loved one being rushed out and going to the OR, at that point, I thought it was doomed. I thought I would never see my sister again. I didn't think that I would ever get to know my niece. And so that whole experience, the 7 days in the labor and delivery as a nurse, you know, I expect a certain amount of care. I don't try to pose my nursing practice on someone else. And so as an ED nurse, I'm not going to say that I know anything about labor and delivery. And so I just expected a little bit more care, education, trying to get her up, you know, trying to get her active to kind of deliver this baby. And I never saw it. There just wasn't much activity. You know, we did the Pitocin thing. That wasn't working. We did some other different procedures. And so like, it was just something that's supposed to be something joyous and exciting, did not turn out that way. And so after that experience, I started to look things up about specifically maternal health, maternal mortality, Black women in maternity, and looking at all the disparities that come with that in terms of hemorrhaging, specifically with cesareans, the increased cesarean rates for your Black women in the community. And so when I decided to go to school and get my DNP, that was at the forefront of my brain was maternal health. And so I started doing a lot of research on it. And then as an ER nurse, emergency department nurse, I was trying to figure out how can I be impactful? So I'm not labor and delivery. You know, I don't know anything about that, but how within my own space and setting, how can I make a difference and educate the nurses to provide, you know, compassionate and appropriate care to patients coming in? And so that is really my journey. And that's how I actually really got involved with maternal health, specifically Black maternal health.
Yeah. Well, that's such a transformational, you know, and directional story that even through that challenge and through that painful situation that your sister went through, you know, it kind of gave you a little purpose into what you want to do, or at least what you decided to look more into. So can you provide for us like a overview of the current challenges that Black women face in maternity care from your studies?
Yeah, actually I can. They look at overall maternal mortality in the United States. So overall, we do, or 3 times greater. Black women are 3 to 5 times greater increase of mortality or morbidity, you know, during childbirth. And so one of the things that we look at, they always try and say social determinants of health. You're looking at socioeconomic status. You're looking at education level. You're looking at, you know, if you're single or you married. And then looking at those things, my sister has her master's degree. She owns her home. She has a husband and she has insurance, you know, so she doesn't fit that stereotype to where you would see just lack of attention and detail and concern or care for a patient. And so, the New York Times actually recently, last year, they actually did they had an article and they looked at the richest Black woman has a higher mortality rate than the poorest white woman. So you can't say, so what's that saying is that it is racial. You can't say that it's, you know, these other factors. There is that component of that implicit bias, that racial bias in the care that we're receiving. And so, yeah, I mean, I think that's one of the things that I've encountered is patients or people just not feeling heard, you know, when they come in with certain complaints. I deal specifically with postpartum preeclampsia. That is my research, or that's my evidence base. And so with that, there are say patients coming to the emergency department, or they come into the clinic. You know, they might have headaches. They might have some swollen feet. They might just not feel well. And it's just seen as, you know, just these signs of, you know, after birth kind of symptoms versus really looking and listening to the patients and how they're feeling.
Thanks for sharing that. I mean, like, all that is substantial. I mean, I'm sure most of us, I can think of some specific, like when you said even the richest person can go through something like this. And as far as a Black person, I can think of some pretty famous people. I believe even maybe a tennis star. I won't even go there, you know, like have experienced some.
Yeah, she's expressed it. Yeah. Serena Williams, even Beyonce. Beyonce's had experience preeclampsia. The more it's actually pretty scary.
It is.
When I'm within my community and I'm talking to other women about preeclampsia, about the morbidity and mortality, there's so many women that have experienced preeclampsia either in the first birth or the second birth. And It's truly scary. It's unfortunate.
Yeah, I personally know a few people, that have experienced preeclampsia at the third birth. So, it almost, makes you want to wonder about the number of children that you have, what number you are within your pregnancy, if that increases your risk or not. But we can think about that later. How have historical disparities in healthcare, do you feel like shaped, the experiences of Black women during maternity?
Oh, well, man, it goes all the way back to, I want to get this right because, I think this is an important note.
Yeah.
They talk about, specifically, Dr. J. Merriam Sims. He's known as a father of modern gynecology, but the people that we celebrate are the women, the slaves that he actually did all of these inhumane procedures to, is Betsy, Lucy, and Narca. Forced coerced unwanted sterilization of Black women from the 1930s to the 1970s. Think of Fannie Lou Hamer from North Carolina, civil rights leader, who once again went in for, a procedure, and then they gave her hysterectomy without her even knowing. And so when you look at the historical background or the history of Black women and maternal health, we've never been really treated, or I guess we've not really been, we've never been asked, I feel like things are just done to us or for us without our voice.
Yeah. Our voices should not be silent, which is a part of why I'm doing this podcast specifically, focusing on this topic. I know we're both healthcare providers and we understand and know these statistics, but, for someone who's not in healthcare that's listening, kind of giving them the avenue to be an advocate for themselves, what barriers would you say Black women encounter seeking maternity care, and how do you believe those barriers differ from other populations regarding these barriers?
I think that might be a difficult question to answer because I know the buzzword is social determinants of health, but
Right.
It does really affect your access to care. And so when you look at the Black population, if you're looking at your underserved communities, if you're looking at all of these maternity deserts, that you have less clinics available now in certain areas. And so you have to go further away for your OB care. It's going to lead to, lack of physicians and or doulas, midwives, nurse midwives, availability and access to care and education and resources to really support you in your prenatal journey.
So all of these are, in a sense, contributions to the disparity that we have with Black maternal health, what you're saying?
The emphasis should be on race. I mean, it's, you still, once again, go back to the article from the New York Times, because you're saying it's not the socioeconomic, it
Right.
might not necessarily be the access. It's how we're viewed, how we're seen, how we're not heard, how we don't have allies or advocates.
So that kind of lends me to go into the next, question I want to ask, more about cultural competency, right? In your experience, how important is cultural competency in improving maternal care experiences of Black women?
I think one of the main things that are happening within the last couple of years is you have this implicit bias training that we have. And actually, I do want to quote also that recently the Assembly Bill in California 2319, the California Dignity in Pregnancy and Childbirth Act, it requires implicit bias training for licensed employees who are regularly assigned to provide prenatal care, and all persons who are regularly interact with perinatal patients, which include the emergency department. And so within our emergency department, we're actually developing curriculum and training for implicit bias. So that's hopefully going to help, not with just when I say Black women, I think I want to say Black birthing people, because I want to make sure that I want to be inclusive and acknowledge all those that can bear children and how they identify.
That's great, because that kind of segued. I was going to ask you a question about implicit bias and its impact, regarding the treatment and care of our Black people, Black or colored Black people. What was the term you just used? Black?
Well, for pregnancy, I just say Black birthing.
Black birthing.
Black birthing individuals, persons.
during pregnancy and childbirth. I mean, so that implicit bias plays like a huge part, a huge role in our disparities as well. Why we may not be heard, why our voices are not heard, so to speak, or why we may not be seen in the same light, I'm trying to say. So studies have highlighted all that you're saying, as far as underlining this ultimate problem, right? I kind of want to figure out a way how we can transition to some potential solutions, right? So in speaking about policy changes, what policy changes do you believe are necessary to improve maternity care for Black women?
There's some wonderful things within the nursing realm that we can do in terms of increasing a more diverse nursing workforce or training more Black and Brown midwives. There's lots of different fellowships and programs now that we have, ensuring that we can have doula support as well. So insurance, I mean, that's always been a huge challenge in terms of those that can advocate for those if you're going into the hospital setting, or just removing that stigma about having a child at home versus going into the hospital. That whole aspect of it. Policies. Yeah. The Omnibus Act is probably the largest one because they talk about also incarcerated, birthing, people and how they're treated, insurance. Like I said, the implicit bias training, diversifying the nursing workforce. Those are just a few on the top of my head that I would say that I'm really excited about that have been moved forward.
All right. So how can our healthcare practitioners, be better educated on the specific cultural and systemic factors that affect Black maternal health?
Specifically in California, each state has a maternal quality care collaborative. And so in California, I think we're fortunate enough that we have one that's really close to us through Stanford Children's Hospital. And so the California Maternal Quality Care Collaborative have lots of different toolkits and resources for anyone, for patients, for healthcare professionals, evidence-based practice. They actually have that implicit bias training that you can go to for free and utilize and provide to your staff and others. I think being involved in different nursing organizations is also helpful if you really want to get involved. We have I don't know when this is going to air, but we, through the National Black Nurses Association, I'm part of as you alluded to, that I'm part of the Black Maternal Health Task Force. We will be having a virtual conference in March. We also have different chapter roundups that we do where we go over policies, we go over doula care, these are important within the Black community and ways to be involved and become advocates.
Wow. That's big. I'm happy to hear that all these things are available and that we're doing that for practitioners, for people who are taking care. What actions can I would say birthing persons, as you mentioned before, take to advocate for themselves within the healthcare system during their maternity experiences?
What I've learned in some of the different conferences and things that I've gone to, I really like this one key thing that someone said is sometimes when you're dealing with the healthcare system, sometimes you have to use keywords that trigger them. Using the word cuss. So I'm concerned. I feel uncomfortable. I feel unsafe. When you use those type of words around nurses, physicians, then they're more likely to listen to you versus you saying, I don't, something doesn't feel right. That generalized feeling that you have, but you can't really quite pinpoint it. But when you use those key words, you're more likely to get a response or somebody respond to what you have to say.
That's beautiful. I think that's very good advice by changing the way working on or making it more clear, the way we speak and use those terms of, this is how I feel, I am concerned. I like that. Can you highlight some successful programs or initiatives that have effectively addressed maternity challenges faced by Black birthing people?
Yeah, I mean, I think I spoke to them. The Omnibus Act is one. So there's 13 bills within there. And so some have passed, some are still going through. Once again, the California Maternal Quality Care Collaborative, a lot of different states utilize those toolkits so that they can use them in their states as well. I think that the National Black Nurses Association is doing a wonderful job with our task force. We're trying to get into the community and providing different resources and platforms for people to speak about maternal health and the challenges that they've had.
What would you say is your vision for the future of maternity care for Black birthing mothers? And what steps should we take, to get there outside of some of the things that you mentioned? Is there anything else that you wanted to share about the vision that you see for the maternity care for Black women, Black birthing mothers?
I think that I feel like we're moving in the right direction. If you're looking at the Joint Commission, if you're looking at CMS, the Center for Medicare and Medi-Cal, they are requiring organizations, hospitals, clinics to address these health disparities within maternal health. And so I think it can only help support and guide us in ensuring that we're all safe. I think the key thing is also decreasing the cesarean rate in the hospitals. Once again, those are quality initiatives that a lot of hospitals are taking. I think the use of nursing midwives, or traditional midwives, your doulas as advocates for you and can support the births that there's no complications, things like that. I think those will help with a lot of the mortality and morbidity rates that we currently are seeing.
Well, I kind of want to move into the words of wisdom segment. You've said a lot, but I believe even the question I was going to ask you, you've kind of highlighted all the way through. So I will ask you this,
Okay.
Drawing from your experiences as an ER nurse manager, educator, and DNP student, focusing, of course, on addressing the barriers, because we've been discussing ways to address this barrier in maternal health. Are there any other key insights or advice or a pearl of wisdom that you would give to a nurse or future nurse, a nurse practitioner, future nurse practitioner, or any students or patients even about effective advocacy in this area? Any last words with regards to that? Because I believe it's very important to not only be an advocate for patients, but for patients to be advocates for themselves. And that's in a large sense about why I wanted to bring up this topic, which we will also discuss more, with another guest at some point, because I want to continue the conversation about Black maternal health as well.
Yeah, I would say my words of wisdom for patients are don't be silent. If you feel a certain way, get on that call light, click it till somebody comes in. For nurses, I think it's important of any color, and I think this was addressed as well, because even as Black nurses, we have our own biases against each other. And so once again, that's that systemic aspect of even healthcare in general and how we provide care to each other and to others. I think it's important to see people as people. I think it's important to be the voice for the voiceless. And lastly, if you have a passion for something, I think go with it with your full heart. When something impacts you, ask questions, be the change agent. Those are kind of the words. I guess it was more than one word, but
what's sticking with me is be the voice for the voiceless. And I think that you're doing that right now. Thank you.
I try. I do, because I shed a tear every day because there was a statistic, and I don't know where it came from, but one of my colleagues says that a woman dies in childbirth every 7 minutes. And so this is not going away. This is something that's been going on for more than 10 years. And once again, we have to continue to push forth and really voice our concerns and really help support our patients and our family, because once again, we all know, I've been in this space long enough to know that, at least one person is either at preeclampsia, has had some kind of, complication in birth. And so I want us to rectify this. I want us to fix this.
Yes. And I think we can, at least we can do our part and be a part of the solution. And, part of that is addressing it, giving information and to people who are even listening today who may not know this information, that we can encourage them to listen, stand up. And then for our future students, for our future nurses, giving them this information, it might not be 100% discussed during their schooling. I mean, we just given, this is a voice to the voiceless right now.
Yeah.
So I appreciate that.
And then my last word, because I do want to quote someone else, Dr. Canty, she said something that was so very powerful to me because I was trying to explain how, as we said, patients need to advocate for themselves and speak up. And what she said to me was, it's not the patient's responsibility to have to speak up. We should be listening. And, you know, as a healthcare provider, as a nurse, you know, I took that. I was like, wow, you are right. Like, why are we blaming or putting that onus on patients to have to advocate for themselves? We as healthcare providers should be there for them and listening to them. They shouldn't have to give us key words and key phrases for us to get the care that we deserve. And so, yeah, that is my hope, my dream, my faith is that we can get to a point where we don't have to provide patients with resources for them to speak and be heard. We should be able to be listening to them.
I feel that. And I know I've at some point have been guilty of that, you know, as a provider. And I definitely want to listen more. And I try to listen to my patients all the time. Thank you so much. Well, folks, this concludes this episode of You Belong in Here. Thank you so much, Crystal, for being an amazing guest, sharing your nursing and your DNP journey, as well as all these pearls. I asked this one pearl, all these pearls of wisdom, you know, be the voice for the voiceless. I am cheering you on as you continue your education and pursue your doctorate in nursing practice, as well as your advocacy, you know, in addressing Black maternal health care disparities. And thank you, listeners. Oh, of course. And thank you, listeners, for tuning in. We hope this episode reminds you that your presence is necessary and your voice matters in healthcare when it comes to being a patient and a patient advocate. Your presence and voices are necessary, and you truly belong in your workplace, and you truly belong in your places of education. And as usual, if you found this episode encouraging, motivating, inspiring, and empowering or in any way, please like it, share it with others. You can find my podcast on Spotify and Apple Podcasts, and my website, belonginherepod.com, where you will find more information about my guests. So tune in for the next episode in 2 weeks, where we continue to explore topics in equity in healthcare and equity in the workplace. Thank you so much. Until next time, take care and keep pushing forward.